If you think someone has had a head injury, there are 6 key things you may find. They may have become unresponsive, even if for a short time. There may be a scalp wound. They may complain of dizziness or nausea. They may have memory loss of events at the time of the injury or before the injury occurred. They may complain of a headache. They may be confused. If you're worried about someone who has had a head injury, you should get medical advice. With someone who has had a severe head injury, you may find that they have had a severe blow to the head, unresponsiveness or a deteriorating level of response, leakage of blood or watery fluid from the ear or nose, unequal pupil size. If a casualty has any of the signs of a severe head injury, seek emergency medical help. To treat someone with a minor head injury, sit them down and give them something cold to hold against the injury, like an ice pack or frozen vegetables wrapped in a cloth. Amy, can you just put the injury? Thank you so much. Assess the level of response using the AVPU scale. Ask yourself, A, is the casualty alert? Are the eyes open? Do they respond appropriately to commands? V, does the casualty respond to your voice? Can she answer simple questions? P, does the casualty only respond to pain? If you pinch the earlobe, do they open their eyes? U, are they unresponsive to any of the above? If they can respond normally, the head injury is probably minor. Keep monitoring their level of response, breathing, and watch for any changes. Treat any scalp wounds like a bleed by applying direct pressure to the wound. When the casualty has recovered, ask a responsible person to monitor and look after them. If a casualty has sustained an injury to the head whilst playing sports, do not allow them to return to the sport until they have been fully assessed by a medical practitioner. Advise them to seek medical advice if their condition gets worse, they're over 65, they've had previous brain surgery, they're taking anti-clotting medication, they've been drinking or taking drugs, or if there's no responsible person to look after them. If you check their level of response and they're not alert, and so you think that they've had a severe head injury, call 999 or 112 for emergency help and tell them that you suspect a head injury. If you can, use a speakerphone so that you can continue to treat the casualty whilst making the call for help. If they're unresponsive but breathing normally, following a head injury, open the airway in the position that they were found, just in case they have sustained a spinal injury as well. This is to reduce further movements to the neck. Call 999 or 112 for emergency help. Continue to monitor the levels of response while waiting for help to arrive. If you think someone with a minor head injury is getting worse, they may show these signs: increased drowsiness, persistent headache, confusion, dizziness, difficulty walking, difficulty speaking, vomiting, double vision, seizures. If you're concerned, call 999 or 112 for emergency help and monitor their level of response. So remember, when treating a minor head injury, sit them down, treat any scalp wounds, and check their level of response. If they have a severe head injury, call 999 or 112 for emergency help. And that's how we treat someone with a head injury. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate. In an asthma attack, the muscles of the air passages in the lungs go into spasm. This makes the area narrower, making it difficult to breathe. This can be triggered by an allergy, a cold, or smoke. At other times, someone may have a sudden attack with no obvious trigger. If you think someone is having an asthma attack, there are 5 things you may see. They may have difficulty breathing or speaking. They may be wheezing. They may be coughing a lot. They may be distressed, anxious. They may have a gray-blue tinge to their lips, the earlobes, or the nail beds. People with asthma usually know how to deal with their own attacks by using their reliever inhaler, usually with a blue cap at the first sign of the attack. But if they don't, or if the attack is severe, you may need to help. When treating someone having an asthma attack, keep calm. Reassure them and advise them to use their reliever inhaler straight away. Advise them to use a spacer if they have one. Amy, use a spacer with the inhaler. Yes. Yeah, well done, well done. Ask them to breathe slowly and deeply to help control their breathing. Sit them down in a comfortable position. If it doesn't get any better within a few minutes, it may be a severe attack. Get them to take 1 or 2 puffs of the inhaler every 2 minutes until they've had 10 puffs. If this is their first attack, the attack is severe, they're not getting better, they're getting worse, or they become exhausted, call 999 or 112 for emergency help. Help them to continue to use the inhaler as needed. Keep checking their breathing, pulse, and level of response. If they do become unresponsive at any time, treat a casualty who is unresponsive. So remember, reassure them. Help them to use their reliever inhaler. If the attack is severe, call 999 or 112 for emergency help and monitor their level of response. If they become unresponsive, treat as an unresponsive casualty. And that's how we help someone with an asthma attack. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate. A heart attack happens when the supply of blood to the heart muscle is suddenly blocked, usually by a blood clot. Lots of people make a full recovery, but there's a serious risk that the heart might stop beating, called a cardiac arrest. It's vital that you help someone who's having a heart attack and call 999 or 112 for emergency help straight away. People who suffer from angina are at increased risk of having a heart attack. Angina is chest pain, often described as a heaviness or a squeezing pain in the chest. The pain should ease within a few minutes if the person rests straight away and takes their angina medication. If the pain does not settle, it is safer to presume it's a heart attack. If you think someone is having a heart attack, they may show some of the following signs. Pain in the chest, which could spread to the jaw, neck, or arms. Breathlessness. Discomfort in the stomach similar to severe indigestion. Collapsing without warning. They may suddenly feel faint or dizzy. They may experience a feeling of impending doom. Pale skin with blueness at the lips. They may have a rapid, weak, or irregular pulse, sweating, or be gasping for air. If you do come across someone with these symptoms, call 999 or 112 immediately and say you think they're having a heart attack. After you've made the call, help move them into a comfortable position to help ease the strain on the heart. The best type of position is sitting on the floor with their head and shoulders supported and their knees bent. Place cushions behind them and under their knees. Then, if you can, and if they're not allergic, give them an aspirin tablet, 300 mg, and tell them to chew it slowly. Aspirin should not be given to someone under the age of 16. If they have angina medication, you can help them to take it. Encourage them to rest. While you wait for help to arrive, monitor their breathing, pulse, and level of response. try to stay calm to avoid unnecessary stress. If they become unresponsive at any time, open the airway, check their breathing, and prepare to treat an unresponsive casualty. You may need to do CPR. So remember, if you think someone is having a heart attack, call 999 or 112 immediately, help move them into a comfortable position, and encourage them to rest. Give them 300 milligrams of aspirin to chew and help them with their angina medication if they have some. While you wait for help, keep checking their breathing, pulse, and level of response. And that's how we help someone who may be having a heart attack. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate. Strains and sprains are common injuries that affect the soft tissues around a joint. A sprain is when a ligament has twisted or torn, while a strain is when the muscle has been overstretched, and a rupture is when a muscle or a tendon is completely torn. There are 3 things you should look for: pain and tenderness, difficulty moving, swelling, and bruising. If someone has a sprain or strain, you should remember RICE, which stands for rest, ice, comfortable support, and elevation. If someone has a strain or sprain, help them to sit or lie down and support the limb in a comfortable raised position. To cool the area, apply a cold compress like an ice pack, cold pad, or frozen peas wrapped in a towel. Leave the ice pack or cold pad in place, or wrap a soft layer of padding like cotton wool around the area. The entire support bandage around the area to hold it in place. This needs to go up as far as the next joint on each side. Raise the injured area and support it with something soft like a cushion, or in this case, you can use a sling. If the pain is severe or they can't use their limb, they will need to go to hospital. Otherwise, just tell them to rest it and to seek a healthcare professional if necessary. So remember, when caring for someone with a sprain or strain, rest the affected area. Ice will help cool the injury down. Give them comfortable support with bandages and padding. Keep the affected area elevated. And that's how you treat sprains and strains.
Shock is a serious life-threatening condition that happens when vital organs in the body are not getting enough blood flow, and this can lead to failure of these organs and the heart. Shock can be caused by anything that reduces the circulation or blood flow, such as severe bleeding, which you may be able to see, or it may be hidden and internal. If the heart is unable to pump blood around the body after problems like a heart attack, severe heart disease, or heart failure. Loss of bodily fluid following severe vomiting, diarrhea, or severe burns. After a severe allergic reaction or severe infection. And following a spinal cord injury. These conditions may all lead to life-threatening shock. When someone is in shock, they may have a fast pulse, pale, cold or clammy skin, sweating, fast, shallow breathing, grey-blue skin, especially inside the lips, weakness and dizziness, nausea and possible vomiting, thirst. As the shock becomes more severe, they may have a weak pulse that you may not be able to feel, restless and aggressive behaviour, gasping for air. They may become unresponsive. To treat for shock, you need to try to reverse the cause of shock. If you find severe bleeding or serious burns, try to treat these whilst reassuring the casualty. Help the casualty to lie down. If possible, try to lie them down on a rug or blanket, as this will help protect them from the cold. Raise and support their legs above the level of their heart, as this will increase blood flow to the head and vital organs. But if the casualty has an injured leg, do not raise it. If the casualty is pregnant, help them to lie with their body leaning towards their left side to prevent obstruction of blood flow returning to the heart. If you haven't done so already, call 999 or 112 and tell ambulance control that you suspect shock. Once you have called for emergency help, you can then loosen any tight clothing around their neck, chest and waist. Stay with the casualty and keep them warm by covering them with a blanket or coats. Try to reassure them and keep them calm. Keep monitoring their level of response. If they become unresponsive, open their airway, check their breathing and prepare to treat someone who is unresponsive. So remember, if you think someone is in shock, treat the cause of shock. Lay them down and raise their legs. Call 999 or 112 for emergency help. Loosen any tight clothing and keep them warm and calm. Monitor their level of response. And that's how we treat shock. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate.
People may faint as a reaction to pain, exhaustion, hunger or emotional stress. It may also happen after someone has been standing or sitting still for a long period of time, especially if they are hot. When someone faints, their pulse slows right down, but it usually picks up again quickly and goes back to normal. If someone has fainted but doesn't come round after a couple of minutes, then this could be more serious. There are 3 key signs of someone who has fainted. They have a brief period of unresponsiveness, causing them to fall to the ground. They may have a slow pulse. Their skin may be pale, cold and sweaty. If someone's feeling faint, advise them to lie down. Kneel down next to them and raise their legs, supporting their ankles on your shoulder or a chair if available, to help blood flow back to the brain. Watch their face for signs that they are recovering. Make sure that they have plenty of fresh air. Ask bystanders to move away, and if you're inside, ask someone to open a window. They should recover within a couple of minutes. As they recover, reassure them and help them to sit up slowly when they are feeling better. If they don't become responsive again, quickly open their airway, check their breathing and prepare to treat someone who is unresponsive. So remember, if someone's feeling faint, lie them down and raise their legs. Make sure they have plenty of fresh air, and when they recover and are feeling better, help them to sit up slowly. If they remain unresponsive, prepare to treat an unresponsive casualty. And that's how we help someone who's feeling faint or have fainted. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate. A break or crack in a bone is called a fracture. A broken bone that does not puncture the skin is called a closed fracture. But sometimes a bone can puncture the skin. This is called an open fracture. Even if you can't see any blood, the break will have caused some internal bleeding, and the injured person may develop shock. Bones that are still growing, like children's bones, are supple and can split, crack or bend quite easily, a bit like a twig, but the injury is still very painful. If you think someone has a fracture, you may see swelling and bruising. They may have difficulty moving and have movement in an unnatural direction. The limb may look shorter, twisted or bent. There may be a grating noise or feeling if the limb is moved, have loss of strength or see signs of shock. If you think you've broken a bone, support the injured part to stop it from moving. This should help ease the pain and prevent any further damage. Place padding around the injury for extra support. If it's an open fracture, cover the wound with a sterile dressing and secure it with a bandage. Apply pressure around the wound and not over the protruding bone to control any bleeding. Call 999 or 112 for emergency help. While you're waiting for help to arrive, don't move the casualty unless they're in immediate danger. Support the injured area. For example, fractures on the arm can be secured against the body with a sling. fracture to the leg can be secured to the uninjured leg with a triangular bandage. Keep checking the person for signs of shock, but do not raise an injured leg. If necessary, raise the uninjured leg. If they become unresponsive at any point, prepare to treat an unresponsive casualty. So remember, pad and support the injured area, use a sling or triangular bandage to keep it secure, cover any wounds, call 999 or 112. And that's how you treat someone with a fracture. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate.